This is LiveWell Talk on New Clinician Spotlight. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health, St. Luke's Hospital. A new aspect to the podcast is a new series. We'll sit down and talk to new clinicians with UnityPoint Health here in Cedar Rapids and allow listeners to get to know their clinician prior to seeing them. Our guest today is Jen Hutchinson, a new nurse practitioner that will be joining the Internal Medicine Clinic at UnityPoint in Hiawatha. Welcome to the podcast.
Thank you for having me.
This is your first podcast ever?
Well, I listen to them constantly,
Good.
But yeah, I've never been on one.
All right, well, welcome.
Thank you.
Start with, where are you from?
So I was born and raised in Des Moines, but I've been in the Cedar Rapids area since 2001.
Okay.
So did all of my education in the area from Kirkwood on up, and then have worked pretty well in this area. I did relocate briefly to the northeast side of the world or northeast side of Iowa, and worked up there in a critical access hospital for a bit while I was finishing my graduate program. So kind of been mostly northeast corridor of the state. And
your graduate degree is in?
So my doctorate is in adult geriatric medicine.
Okay.
Primary care from the University of Iowa. I got that in 2017. And then I'm currently getting my psych post-grad. So I'll be done with that in August.
Oh, wow.
Yeah.
Neat. That's...
Why do I do it to myself?
Well, but you know, I think that's a great combination of geriatrics and psychiatry, because I've said this on other podcasts and to other people that when I started, 25 years ago, it was just convenient that the psych ward was connected to the hospital,
Sure.
right? People were relatively healthy. They
Right.
might be paranoid schizophrenics, but they didn't. Now it's diabetes, sleep apnea, heart disease,
Right.
epilepsy.
Yep.
They're really complicated patients.
Right. And what we're finding, or what I'm finding anyway, is that, your mood directly affects how well you manage your other
Absolutely.
chronic
Yeah,
diseases.
absolutely.
So they're very
Absolutely.
intertwined.
Yeah, they really are. And I think it's a good compliment. But also, Dr. Troutman's internal medicine pediatrics, that's a good compliment. Dan's a sharp guy. You'll enjoy practicing with him.
Yeah, my office is right next door to his.
Is
so
it?
we give each other crap all the time.
All right.
And we just added family medicine out there too. So we've got 2 providers that do family medicine too. So my niche is kind of 13 on up. Then we've got the ones that do the whole lifespan. And then we've got Dr. Troutman, who specializes in both. So it's kind of a neat little mix. And the things that I like to do, some of them don't like to do. So we have a lot of collaborative practice out there, which is nice.
There's some great clinicians out there.
Yeah.
Dr. Butler is very solid.
Yep.
I mean, he's
been in practice a long time.
Yeah. A little bit older than me. Don't repeat that. Maybe we need to cut that out of the podcast. So what made you choose? So you went nursing, then ARNP. Tell us about why'd you go into nursing?
Oh man, the really short story is I tried to avoid nursing. A lot of my extended family is in healthcare. I really did not want to do healthcare. I wanted to buck the system. I had intended to do school counseling. That was my and the irony is I decided not to do that because I didn't want to go to school that long. And
so you've gone even longer now.
Way longer. Yeah.
That is irony.
But the pieces are still there. I really love dealing with youth and any person in transition. So people who are kind of floundering about, figuring out their place in the world. That's sort of what I really like. So that speaks to the school piece. And then, counseling, of course, we do that with our patients on medications, education about lifestyle choices, all those things. So there's still a piece of that in there, but it did go more healthcare route, largely because my children were delivered by midwives. And I loved the model that presented into my life, and thought initially I wanted to do that, and then wanted a more broad scope. So went primary care.
Yeah, anesthesiology and obstetrics, they're 2 specialties where it's just like routine boredom or like total chaos emergency.
Right.
There's like no in between.
Right.
It's like just another day at the office,
Yes.
save someone's life.
Correct.
One of the 2.
Yep.
Yeah. So what you mentioned geriatrics and that people finding themselves, I think was the term you used, or transitioning. But what other clinical interests do you have?
Well, I wrote my dissertation on sexual function and sexual dysfunction, so both psychosomatic and physical reasons. And what I found in my research is that we as clinicians are not good about asking about our patients if they're experiencing trouble in that arena. And by doing so, by asking, we're really treating at least 2 people, right? So if we treat one person's sexual function, their partner or partners benefit as well. So We found during my dissertation work, I found that it's more prevalent than all of the main chronic diseases we screen for. So 41% of the female population experiences some sort of sexual dysfunction in their lifetime. So I really developed a passion for that and, have pretty candid conversations with my patients about what they're experiencing in and out of the bedroom. And so that's a clinical interest I really have. I'd like to do more work with sex medicine as I finish my psych stuff and dealing with kind of the psychosomatic things that go on with it, as well as the interpersonal things that go on with it.
Right.
So that's definitely an area I'm really interested in. And I'm really interested in marginalized populations. I've done a lot of volunteer work and career work in free medical clinics and people who are not native English speakers and people who are not cisgendered and people who are not Caucasian. And, I think that in healthcare, we're doing better now, but historically have not been good about representing some marginalized communities. We are naturally ableist. We think about, is this easy for the general population? Well, what about our deaf people? What about our blind people? What about our people with disabilities? So I'm hoping to be a voice for those folks that just don't feel like they have somewhere to go, that someone will listen.
I think for clinicians to think about social determinants, or as a student once said, social capital, which I think is a great term.
Mm-hmm.
I love that term, social capital. You can ignore it as the physician, right? It's still there,
right?
It's still going to yield bad outcomes. I always say, this sounds shallow, but maybe it's meant to be. If you live on Country Club Drive, you're probably not getting readmitted.
Right.
And you're probably taking your medicines because you just have this social network. But I do find it interesting that I think lower socioeconomic people, they have more friends.
Mm-hmm.
You see, you see more neighbors bringing them. You see more people. They have like a closer bond with their neighbors than I think the other end of the spectrum. So that there's like a lot of things in life. There's good things and bad things, and it's always the greatest compliment you can have as a clinician is the gratitude of a patient that you've made their life better. Definitely. It just takes one. Just takes one to make you feel like you're worth coming into work today,
Yes. I think patients sometimes underestimate what a thank you means. I've had patients I've bumped into later, particularly when I was serving the underserved population, that are just like, you changed my whole life. And it's 1 out of 500 people. But that one counts for way more than the 5 grumpy ones.
Yeah, absolutely.
Yeah.
I was thinking, we've mentioned one other time that somewhere out there's a stranger that you were kind to. You don't even remember the event, right?
Mm-hmm.
You just said thank you, at the right time. And they still remember you for that. And you don't know that. You could have been on vacation, whatever, But I think that's the neat thing about just making people feel good.
Yeah, I agree.
Now, what led you to UnityPoint Health?
Well, a few things. It was multifold.
The podcast, you've
heard of this
podcast?
I heard Dr. Arnold ran a podcast, and I said, I got to go.
We get that a lot.
Actually, I worked at UnityPoint Health as a nurse out at Jones Regional for 5 years. I helped get that surgery department up and running, and was in that system for 5 years, had a really positive experience. The only reason I left is I took a salaried position so that I could finish my graduate program. And it was the hardest goodbye I've had career-wise. We all cried. It was a big deal. And so that's all. If anybody asks me still to this day what my favorite job was, that's my answer. So I've been kind of in academia for the last 3 years and didn't have as much patient contact as I wanted. So that was a kind of natural transition to getting back into clinical practice. I wanted to be close to home. I live in Cedar Rapids. I was commuting a lot with my clinical sites through the university. And, so it was a twofold. I wanted to be at home, and also I wanted to be patient contact, be the primary focus of the position. So it was a natural fit.
And with the price of gas, you don't want to be driving too much these days. That's getting crazy.
Mm-hmm.
Well, if you could share one message to listeners, and granted, these listeners are potential patients of yours, what would you share with them?
Well, I think the thing that sets me apart a bit is I have a really diverse social circle. I have a really diverse family circle. My children are biracial. My brother is gay and married to a man. He's also an amputee. So I just feel one of my best friends is transitioning. So there's really not a topic that makes me uncomfortable. I'm pretty open. I have moonlighted in jails and prisons, so I'm even familiar with that population. So there's really not much that makes me nervous, uncomfortable, feel awkward. So, I would just encourage, not just if they're my patients, but any patient that's seeing a clinician to feel open. And because most of us are pretty receptive. We may not bring it up ourselves adequately at times, but most of us are pretty receptive and want to hear what's going on in our patient's life.
Right.
So I think that's the thing that I would take away. I think the healthcare world is shifting to realize we are whole people and not just a heart, not just a set of lungs, not just feet, and treating the whole person. Because as you mentioned, what good does it do writing a prescription if they can't afford the medication? So we can only do so much with limited information. The more information we have, the better we can provide adequate care. So I think that would be the thing, to develop relationships with our patients versus just, factory work.
Yeah. When I was a medical student, so the early 90s, you said the gallbladder in room 450. You didn't say, well, it's somebody's mom that's in 450 that happens to have a bad gallbladder, and that's changed over the years. That's definitely changed for the better. And I like to think that we have a pretty good culture here. And what is culture? It's your behavior and your beliefs. And I think people believe in doing the right thing and putting the patient first. And I think they behave that way. And that's why I wouldn't want to be anyplace else.
Yeah.
So, well, some fun questions at the end. What do you do in your free time?
Get out of Cedar Rapids as often as possible. I love to travel. Traveling sort of I get home from a trip and start thinking about my next one. So that's where we aren't big things people. We aren't fancy car people. We aren't fancy house people. We are let's take our next trip type people at my house. I have 3 almost grown children, so they're really fun to travel with because they're not as much work anymore. And so my boyfriend and the kids and I will just take off. We went to New Orleans over spring break, road trip. Just let's go.
Wow.
And had a blast. So
that's a commitment.
It was awesome. We had so much fun. And did have a couple spooky experiences for people into that. And then I love to read. Right now with being in school, I'm not getting a lot of downtime to leisure read, but I do love to leisure read. I'm also, this is a little embarrassing, huge musical fan. Huge music fan. If you are driving down First Avenue and hear somebody playing Rent at the top of their speaker,
it's you.
Probably me.
So that's probably the one thing that people don't know about you that we'll learn.
That's I've been caught screaming out my window to some sort of musical song, but those are probably the 3 things that kind of make me tick a little bit.
Well, those are 3 high quality things. I mean, that's one of my colleagues here, and I won't mention his name, but he's planning a family trip, kind of RV style with 3 little kids. And I said, look, you're going to have car trouble. They're going to puke. You might lose your wallet, but 20 years from now will be the best trip you ever took. It'll be the one you talk about at Christmas.
100%. We were supposed to go to Italy in 2020 when the world shut down.
Yeah.
And I had 2 weeks off of work. And it's like, well, what am I going to do with this time? So we rented a minivan and did Route 66. And we drove to Phoenix, San Diego with 3 teenagers. Just me at the time, me and my 3 teens. And we were gone for 11 days and traveled 10 states, and my favorite trip so far. And I've been lucky to go on some pretty great trips, but it was one of those, they're fighting in the car and listening to murder podcasts.
Yeah, absolutely. I can think of all the vacations we've taken, and, those memorable events are, when one of my daughters, we always say it's not a vacation until she pukes from motion sickness, and those are the things you think back upon.
100%,
So, hey, Jen, thanks for stopping by.
Yeah,
I really
thanks for
appreciate
having
it.
me. Yeah.
It was fun to get to know you, and I look forward to you being successful at UnityPoint Health, Cedar Rapids, in the Internal Medicine Clinic. Once again, this was Jen Hutchinson, a nurse practitioner at UnityPoint Clinic Internal Medicine out in Hiawatha. To schedule an appointment with Jen, call UnityPoint Clinic Internal Medicine Hiawatha at 319-362-0200, 362-0200, or you can always visit unitypoint.org. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.